The ideogram way can be translated as cord, tie, fiber, or filament. It includes the concepts of binding, tying, joining, or gathering, as well as those of holding, safeguarding, or preserving. The type of binding offered by the Wei Mai is not the holding of a cord, but the cohesion provided by a mesh or net that harmonizes all that which it delimits. The Wei Mai's nature, related to the arms, is celestial. Again, we find that we are in the peripheral yang meridians, which have in turn yin of yang, yin Wei Mai, and yang of yang, yang Wei Mai. Yin Wei Mai affects the upper zones, which are yang but interior, throat, chest, heart. On the other hand, yang Wei Mai usually affects not only the upper part of the body, but also the posterior part, yang of yang. Therefore, its key point, Y1, treats headaches or pain in the upper dorsal area. These shell-shaped resonances are very typical of the yang Wei Mai disturbance and even affect the lumbar area. In other words, according to its nature, the symptomatology of Wei Mai usually affects the upper part of the body, not the feet. The physical symptoms that a yin Wei Mai alteration can give, for instance, pharyngeal constriction, asthma, palpitations, or precordial twinges, which is very typical, are symptoms often triggered by emotional disturbances when facing conflicts with other people, since the thorax is an area of exchange with the outside. We already see in its functions, for example breathing. It is thoracic and consists of an exchange with the outside. Ingestion is also related to absorption from the outside. So it is from the thorax that the individual lives their relationships with the environment. And it is this exchange with the outside what gives rise to the energetic movements that manifest themselves in the form of emotions or feelings. Let's look at the pathology. When the affected person is a yin Wei Mai, the subject tends to be cyclothymic, to go up and down in mood, oscillating between feeling euphoric and sad. They also tend to suffer from restlessness, anxiety, and fears, phobias or hypochondria, which are derived from this kind of fear. On the other hand, the energetic shell of yang Wei Mai can become tense on the surface, as we have seen, causing migraine, cervical, dorsal, or joint pain. Emotionally, these symptoms are often accompanied by irritability, which indicates that the yang energy governed by this extraordinary meridian is blocked. It is typical, therefore, that the pathology of yang Wei Mai is accompanied by discomfort in the face of sudden climatic changes, which can announce, trigger, or aggravate these symptoms. Another typical feature of yang Wei pathologies is intolerance to confinement, known as claustrophobia. And this is because enclosed spaces increase the feeling of pressure that the individual already suffers. And not only physical enclosed spaces, but also those situations in which the individual feels trapped can trigger pathology, irritability, or intolerance in those subjects having a yang Wei Mai meridian tension. Often, the extraordinary meridians, which often give rise to very chronic pathologies, manifesting themselves from childhood onwards, in the case of the Wei Mais, configures an hypersensitivity that characterizes the subjects prone to suffer from disorders of these meridians. These are the most frequent causes of alteration of the Wei Mai, but nevertheless, in the same way that an overload of social, professional, or archetypically masculine pressure could resonate on Du Mai, for example, a forced confinement, such as having been in prison, kidnapped, or in a concentration camp, can trigger the appearance, even if it did not previously exist, of a pathology that resonates in Yang Wei Mai. And this is because such forced confinement is affecting the meridian's functions. Unlike what happens with their nature, in their dynamics, the Wei Mai that are yang respond to yin phenomena such as space. This means that these peripheral meridians are the ones that discriminate space, especially the inner from the outer. Yin Wei Mai is said to harmonize the internal. It has a lot to do with how people feel inside, whether they flow within with ease and smoothness. It is frequent that in people with Yin Wei Mai alteration, there is a lot of internal restlessness, anguish, anxiety. They tend to be cyclothymic because there is not enough harmony in their state of mind, which is normal to fluctuate, but in such individuals it does so very sharply. It is also common to find among Yin Wei Mai people, of course, we doctors see these patients a lot, phobias or hypochondria, which is another form of fear. On the other hand, Yang Wei Mai has to do with the periphery, with the external shell with which the subject isolates himself from the external world. When it is said that Yang Wei Mai governs the outside, it means that it governs the periphery. It governs our physical structure, you see, the muscles, and the tension that people sometimes have on the surface in certain situations of the environment, when perceived as aggressive, often respond to a secondary alteration of Yang Wei Mai. The function of the Yang Wei shell is to establish an energetic boundary that separates the outside world from my inner world. But this energetic shell is sometimes strained, where is the great need to separate from the outside. My personal image of a tense Yang Wei is the shell of an egg. It becomes rigid in an attempt to protect a very fragile content. But it turns out that when the shell is so rigid, when you hit it, clock, 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 everything inside resonates. By this, I mean that it's common to find in people with Yang Wei Mai nature, constitution, call it what you will, that they end up being very sensitive to the outside because everything that happens outside reverberates inside. When we say environment, we can refer to the climate. Yang Wei Mai people tend to be meteorosensitive. Thus, many migraines and arthralgias that appear before sudden changes of weather climates are pathologies of Yang Wei Mai. But in the same way, Wei Mai individuals are also characterized by being sensitive to their emotional environment. Those are people like sponges who absorb without filter everything that happens around them. Obviously, with the people they love or appreciate, but by the same token, also with anyone around them. They seem incapable of abstracting themselves from the emotional environment that surrounds them. The classical texts have been interpreted according to the motto that, unlike the Chiao Mai, which often maintain a dynamic equilibrium, I clarify this for the specialists. In the case of the Wei Mai, there's a total separation between Yin and Yang Wei Mai. But the laws of yin-yang have no exceptions. There could be no unrelated distinction between yin-yang. That would mean death. In fact, I often find it difficult to distinguish whether I'm dealing with a yang or a yin Wei Mai, whether I'm dealing with a bouncing yang Wei egg or a very permeable and sensitive yin Wei sponge. The pulses help in the diagnosis. Normally, those of the yang Wei are superficial, while those of the yin Wei are deep. In addition, the type of rotation, outward or inward, of the radial pulses also helps us in the diagnosis. People with a fragile yin Wei Mai are prone to internal and emotional dysfunctions. They tend to be hypersensitive and fickle. Regarding yang Wei Mai, we can suspect that its creative function of harmonizing the periphery is disturbed when the person is ungainly or clumsy. They tend to be people with lots of energy, but disorganized. They also tend to be extroverted, because they're young, often very busy in their professional field, which is a yang archetype also, remember. As you may recall, the archetypal yang resonance was masculine, social, with respect to yin Wei Mai, which tends to appear in individuals who like more restricted and intimate interactions. In clinical practice, it is not uncommon to find the surface yang Wei tension as an automatic protective reflex in a fragile and vulnerable individual. I have often met patients with a fullness of yang Wei Mai that is precisely protecting the fragility of yin Wei Mai, its brother, peripheral, extraordinary vessel. I have also met people with the fragility of their ren Mai protecting themselves by tightening their yang Wei Mai shell. That is to say, I have come across clinical cases in which a yang Wei Mai tensed in the periphery, in which, although it was relieved by treating the corresponding point, the symptoms only vanished by supporting and nourishing the inner fragility that caused this tension. For instance, a ren Mai deficiency. And this is why I think that acupuncturists, we have the obligation to look from the surface to the depth, because the deeper we understand, the better we will be able to achieve a complete resolution of the energetic conflict of our patient.